Hello, I'm Dr. David Burv with the Float Zone, and we're here with Nia, who has participated in one of our case studies on chronic neck pain and flotation therapy. Tell us a little bit about the condition that you were in prior to the neck study.
So the condition that I was in prior to the neck study was an ulnar nerve situation that began about 3 years ago. Started in the wrist, moved up to the elbow, settled permanently in the neck and spine, and then finally took feeling away in my ring and pinky fingers on my left side.
So you floated twice a week for 4 weeks. How soon and where did you begin to notice difference?
I started noticing a difference about 3 floats in, and the results went in reverse to when the symptoms arrived. So the first to go was the neck, next was in the elbow, third wrist, and then last in
This
the
is where you
pinkies.
began to get your feeling back or began
Yep.
to feel better in those areas
Yes.
after 3 floats.
3 floats is what it took.
And were there other areas that you noticed improvement as well, like in your sleep or in your emotional state?
Yeah, when I began to float regularly and consistently and began to put it as a regular part of my routine and week planning, I noticed that the quality of my sleep increased to better and more sound and more still sleep that wasn't as turny, like I wasn't as restless. And then I also began to notice an improved or more optimistic sort of like emotional outlook after the same number, about 3 floats, a complete shift in emotional state.
So it's been a matter of months since you've ended the study, right? How long did those positive gains last?
They're still here. I think that floating provided me with a permanent shift in sort of spiritual and mental wellness due to the solitude and darkness that it provided was exactly what I needed to sort of like shift and move into a different perspective and outlook on my own life.
Thank you very much for sharing that with us, and thank you for your interest in flotation therapy.